Okay, let's move on. Our next presentation is entitled Babylon, Making Quality Healthcare Accessible and Affordable for All. It's presented by two people. One, Claire Morris, is the Director of Social Impact at Babylon Health. She's joined also by Dr. Shivon Byamukama. She's the Managing Director at Babel Health Rwanda, and their presentation is coming up next.
Hi, good afternoon and good morning. We're really happy to have the opportunity to speak at the Africa Health Week and to talk about our work, Babylon Health's work, both globally and most specifically in Rwanda. So I'm Claire Morris and I'm the Director of Social Impact at Babylon Health, and I'm joined by Dr. Shivon Byamukama, who is our Managing Director of Babel in Rwanda. We'd like to talk to you today about our global work, which is really around our mission and vision to make quality healthcare accessible and affordable for all. We set off with this vision really with a view of considering the real challenges globally around healthcare, which of course will be very, everybody who is part of this week working in healthcare in Africa will be very aware of the challenges of lack of resources in healthcare, the affordability of healthcare, and it's something that Babylon is determined to try and help solve. And we're doing this by thinking both about the accessibility and how people could use their mobile phones to access as much of their healthcare as possible, as well as how we use technology, particularly AI technology, to make everything that we do more affordable, and how we really ensure that we strive to have the highest possible quality in everything that we do. So as a company, we actually were founded in the UK, in London, which is where I am now. And we've gone through an extraordinary journey over the last few years of growing, both in terms of, most importantly, the number of patients that we're able to serve, but the number of countries in which we're working and the number of partners that we have as an organization. So this is just a snapshot of some of the achievements and coverage that we have. Very importantly, thinking about our patients. Both we are now covering 20 million patients worldwide, and is critical to us what our patients feel about the service and products that we provide them. So we are always looking at the rating, and we're very proud to have 90% of our patients rating us 4 or 5 stars, which is critical to us as an organization. We now have over 2,000 team members across different geographies. And I will now talk a little bit more about the different geographies and partners with whom we're working to really make healthcare affordable and accessible for all. So we actually kicked off our work in the UK, started in fact with virtual consultations, and have had a number of partnerships in the UK from private insurers and corporates, but very importantly with the NHS. And in fact, we run something called GP at Hand, which is the largest GP service in the UK, and with over 100,000 users now using our service, and that is obviously in partnership with the NHS. We then set up in Rwanda in 2016, which is what Shivon will talk about in a minute. And from there, both our service, our number of partners that we work with, which range from governments to insurers to hospital systems, that has grown. And we have, as has very much our product and service has evolved and grown over time. So we are working across Southeast Asia with Prudential Insurance, in 11 countries in the APAC region. We're now working in Canada with TELUS Health, and expanded into the US as well. So we have a range of geographies as well as types of partners that we work with. Fundamentally, what we're trying to do and thinking about the user is really thinking about how we can address as many healthcare needs as somebody has in one place. So really taking this digital first gateway, so really the starting point being what we can do digitally over somebody's mobile phone to provide a user with as many services as we can via that device, which includes both proactive chronic care management, such as the areas of diabetes, as well as digitally managed care pathways when somebody has greater, longer term needs of care, and really all the way through to how we can support people pre and post operatively. So we've really built out this whole model, which starts from using our AI technology at the center through to virtual services and physical services, but supporting people both when they're well, to stay well, and when they're sick, to address their needs quickly and effectively in a very high quality manner. What this looks like and feels like from the perspective of a user, these are sort of screenshots of what our mobile app looks like. And we have tools that, as I mentioned before, are thinking about supporting the individual when they're well. And that includes a health assessment, which is a snapshot of somebody's current health status. It's a series of questions that then give the user feedback on their level of risk based on a comparable cohort, same age and gender of that person, as well as really actionable recommendations on how they can reduce their risk. This then is represented in a digital twin. We have a tool to help manage more chronic care conditions. And then in terms of the sick care, we have a symptom checker, which enables people wherever they are to be able to put in their symptoms and get some advice and information about what their condition could be and what the sort of best course of action for them would be, through to virtual consultations, physical consultations, which is always going to be part of a healthcare journey. And as I mentioned, all the way through to supporting people pre and post operatively. So that gives you a sense of this really fully integrated journey that we have now been able to build for patients, working with a range of partners and clients across the world. So I'm now going to hand over to Shivon, who's going to talk about what we're doing in Rwanda.
Thank you very much. Babo was founded in 2016 to help Rwanda achieve its main issue of ensuring that there's quality healthcare throughout the country. We so far have 2.5 million registered people. We have completed about 2.2 million registered users, and we do an average consultations of about 5,200 every day. We have a contract with the government of Rwanda that we signed in March of 2020, in which and it's a 10-year contract, which allows us to provide the services that we do. About 86% of the population is insured by the insurance policy that we have a contract with, which is the Universal Health Insurance Program. And we also have partnered with about 500 health facilities of the 506 health facilities in the country. And this is how it works. As you might be aware, the majority of the African populations, while they are connected and have mobile phones, the majority of them do not have smartphones. So our service works on a feature phone or any phone that somebody has. And this has been adapted for the context that we're operating here in Africa. So how our service works is that somebody uses whatever phone they have, dial 811#, using a USSD application, and seek for an appointment. You would first register with us, seek an appointment with us, and you're seen by a triage nurse. A triage nurse will call you and find out what is the condition that you're suffering from. Majority of conditions are conditions that we can treat, but sometimes there would be conditions that would not be suitable for digital health. If it's a condition that is suitable, then then the senior nurse, makes an appointment with a doctor or a senior nurse who can do a complete consultation with you. The doctor will call you and complete the consultation and give you advice like you would in a physical facility, or make prescriptions, send you a prescription code that you'd get via SMS, or a laboratory test that you'd also get by SMS. You'd then walk into a health facility of your choice and be able to pick your medication or to do the relevant tests. Once you have done the tests at the health facility, the tests are sent back into a system in which the doctor or the senior nurse can complete a consultation that they have done with you. In about November of last year, obviously during the pandemic, we've played a significant role by supporting the home-based care solution that the government suggested. Majority of patients, obviously throughout the world, over 90% of patients do not need to go to a physical facility. So for those who are staying at home, we work with the government to take care of these patients who are asymptomatic or mildly symptomatic, who we then take care of. A Babo staff will, supervised by a GP, will call the patients every day to monitor their symptoms, provide information, and provide records on this program. So on a daily basis, the patient is also sent SMSs to be able to do, and it's a two-way SMS for the patient to tell us how they're feeling. And only when required, do we then send the patient to further care at a physical facility. During this process, or when we are doing care, we could give prescriptions to the person when it's required, and only when it's necessary do we then send them to a physical facility to take care of. We look after all the COVID patients that are at home, and we look after them until they test negative for COVID-19. This is the support that we are providing for the government. But in addition to this, for the services that we provide for, is that when we treat people digitally from home for any conditions, even other than COVID, then we are decongesting the health facilities that should focus on the really critically sick, especially during this very trying time. In Rwanda right now, and in a lot of the African continent, we are now going through another skyrocketing phase of COVID-19, where there are so many cases and very many hospitals are currently stretched. So this is the support that we are providing at the moment. Next slide. This slide shows the partnership that we have with the government of Rwanda. One, we talked about the 10-year contract we now have with the government of Rwanda. But as you know, healthcare is an ecosystem. You can't do it alone. It works within the whole ecosystem. So we have a relationship with the National Identity Agency, where we identify the agents that where we identify the patients so that we are treating the right patients. We have a relationship with the Ministry of Health so that if somebody is treated digitally, they can go to a laboratory test or a pharmacy and get their medication or laboratory test from those places. These are also paid for by the Universal Health Care System in Rwanda, which is the relationship we have with the Rwanda Social Security Board, which funds both the consultations that we do, the prescriptions, and the laboratory tests using the Universal Healthcare System. We have close collaborations with the Ministry of ICT, the Rwanda Development Board, and all our other partners, including the mobile providers, network providers, private pharmacies, and private insurance companies as well that use our services. Throughout this period, we have done a number of surveys, and one of the surveys actually done by an external party, which was Dalberg. And we found that 95% of our patients would recommend our services. 89% were satisfied with our experience that we have. In terms of quality of access of service, digital health has benefited patients equally in Rwanda. Both men and women are likely to use our service, and patients from all age brackets are also able to use our service. In terms of speed of access, 83% of patients finish their consultations within the hour, which you compare to a physical facility, which is only 33%. 85% of patients score us at 4 or 5%, at either 4 or 5. for ease and accessibility of our service. And 94% have rated their clinical consultations are rated about 94%. Next.
So when we think about the technology and service that Babylon has kind of evolved globally, we're constantly looking to evolve and enhance what we do and make it further sort of affordable and accessible for our users and patients. So in the particular context that Shivon has outlined, and obviously you've already heard about the sort of the adaptations that the team have made to make this work and make this really have sort of national level coverage and integration with the public health system in Rwanda. We also want to see how we can introduce some of our AI tools in Rwanda to further make healthcare affordable and accessible. So what we're doing at the moment, our AI model, and in this case, we're referring to our symptom checker that I talked about in one of the earlier slides. We've taken our model, and it's a model that is now being used in 17 countries and that we've localized for a number of contexts. We've now localized it for Rwanda, and that means localizing the epidemiology, localizing the language, localizing the care pathways, and making it appropriate for the culture and environment in which that service is going to be provided. And our first point of call will be to introduce it into our call center, where Shivon's team of nurses will use it as part of their triage flow, which we believe will help to improve the efficiency, the consistency, and quality of what we're doing. And the second phase, which is a project which is being funded and supported by the Bill and Melinda Gates Foundation, is for us to take this tool and to use it in a trial in a number of public health facilities in Rwanda, to see whether this tool can really help to support and ease that congestion that Shivon mentioned, which, around the number of people who are going into health centers, the efficiency of triage, and to support people to have access to our service as well, which obviously they are entitled to through the Mutuelle scheme. So this is a project. It's a new use case for us of our AI technology, but we feel is a really appropriate and exciting adaptation that we can do to make healthcare affordable in the context of Rwanda specifically. And in everything that we do, we're always keen to strengthen our understanding of how digital health can be used to transform clinical outcomes and healthcare. So we are continually building the evidence for digital health, and Shivon has mentioned the study that Dalberg did of our work. We're now entering into a phase where we're having, in fact, an independent impact evaluation that's being led by the Rwanda School of Public Health to really look both at our service and the user experience and the effectiveness of what we're doing, but also look at the wider circumstances in Rwanda that has led to this very successful adoption of digital health as part of the suite of tools that are available within the health system to really address healthcare needs. And as an organization, we're constantly disseminating and engaging in this very vibrant sector, which is digital health, to really make sure that we're sharing our lessons and our experience with others in the sector to really help to see how really digital health can really fulfill the opportunity that I think it does provide to really address some of the most serious needs of healthcare and the serious challenges of healthcare, particularly in the context that we're talking about here, which is Africa. And I think with that, we would like to obviously thank you for listening to us and for giving us your attention. So thank you very much.
Thank you.
And here are Claire and Shivon now to answer your questions. Welcome to you both. Thanks for that presentation. Claire, I'm going to come straight to you with a question. You mentioned the platform and the fact that data has to be inputted from the patient. How accurate is that data, given that, for example, if you were asked a question about your pain threshold, some people's pain threshold, is 9 out of 10, and some people are 2 out of 10. When you step on and off the scale, sometimes you get different measurements for weight. How can we be sure that that's accurate?
So we have a huge team of data scientists, clinicians, engineers who work on our model, who are constantly evolving it, constantly learning, testing. And this is something that they've kind of refined, and they've really kind of understood how kind of users engage with these types of tools. So this is it's constantly evolving process, constantly tested and checked, very high levels of security and safety. But it's something that I think the whole sector continually learns about and really understands kind of how individuals engage. So I would say we have a lot of confidence in what we do and how our users use our tools and products.
And with that, if people are using your tool, it takes them away from Dr. Google, as we call it here in the UK. People trying to self-diagnose and coming back with quite a lot of different answers, and often quite worrying. You can have a headache and think that you've got a brain tumour, and all of a sudden you're going down the wrong path, aren't you? So this is a potentially a safer way to engage.
Absolutely. It's about providing people with a really kind of curated information and advice. And obviously it doesn't replace needing to see a clinician. It's just giving people that sort of initial kind of reassurance and information when they are at home or wherever they are, where they have their mobile phone, to give them sort of that a bit of sort of reassurance and guidance and recommendations around when it is the right time to escalate to speaking to a clinician. And it is, as you say, we are in a world where people have access to a huge amount of information online, and this really helps people to funnel them to much more accurate and safe information.
Brilliant. And Shivon, congratulations. It sounds like the rollout in Rwanda is really going well. It seems like there's been a high take-up, but there must be some challenges, I would imagine. You mentioned there, not always using smartphones, but using text phones. Do you come up with much resistance or challenges from people, say, who maybe struggle with dyslexia or maybe have dementia and aren't quite sure about using the technology? Maybe age is a barrier. I'm thinking of my own parents who are both in their 90s.
So what we have done, because we know that adoption is a challenge, we've decided to involve agents to support the system. And obviously not only the issues that you have mentioned, there's also high illiteracy, not just literacy, but also digital literacy. So one of the things that we do is that we have hired a couple of agents in some of the health centers that we work that will take you through the system of accessing our care. So if you choose to use our platform, they'll say this is how you dial 811#, this is how you seek for an appointment. But the real issue is to personally teach you how next time you don't need to come to a health facility, next time you can stay at home, and this is how you use the service. And this is what we consistently do to sort of see how many people can now use the platform on their own without support. So in about 2019, the percentage was about 10% of the population. 10% of the people that are calling us, and that number has grown to 38% of people who are individually able to consult with us without any help. So yes, these challenges are there, and there are so many challenges that come across. But the plan is to sort of say, identify what the challenge is, and sit as a team and say, what is the solution to this particular challenge? And I think that that's how you get the milestone as you go along, sort of addressing challenge by challenge as they come along.
Sure. And often it takes something like a national pandemic or a war or a famine to accelerate the take-up of some of these innovative ideas, doesn't it? And in your case with COVID-19, certainly in a lot of the areas that I hear about, people were positively discouraged, couldn't go to a doctor's or a medical practitioner. They were told to stay away. And so your technology really steps in there, not least of all because it helps with distance for people who are, perhaps not able to travel, people who've got young families who can't get out the house. This has got to be a breakthrough, hasn't it?
Yeah, and we've seen that increase in terms of our numbers. So before the pandemic, our uptake was high, and on one of our products, the numbers in the first lockdown in Rwanda grew by 155%. So the uptake grew by 155%, and that is really responding to the question that you're stating. People were discouraged to go to health facilities and so on. And right now, actually, I don't know whether a lot of people know that we are going through another wave in Africa. And so we're going through another set of lockdown and so on. And now we are really, really busy at the moment because, for people who are not going to health facilities and so on. But also, one of the things that we're doing is we see ourselves as a preventative role because in Rwanda, we know that the healthcare system is fragile, and there's so many things that the measurements that the government has put in place to sort of distance and so on, so that you don't get infected. And our role as Babo as well is to make sure that when you're not feeling well, we treat you from home. So we even actually have a program with the COVID-19 program where we look after patients who are calling from to stay at home so that they don't go to the health facilities. So two things. One is that we're supporting the COVID-19 patients themselves, but also by treating people from home, we are decongesting the healthcare system, which really should concentrate on those who are critically ill.
Yeah, and I think that's the same worldwide. Claire, you probably are familiar with that weight tone. You are number 36 in the queue, or bounce backs. And is this a resource-intensive app? I mean, if there is a nurse involved at the other end, then they've got to be available to take the message and then respond to it. Are we going to have to increase the number of nurses and healthcare staff?
Well, I think Shivon's team, really, they've got a very well-structured and well-managed team where they're able to kind of respond to people's initial calls very quickly and actually have a very good system. But I think maybe, Shivon, you can talk a little bit about kind of how you're managing the resource that you have and your ability to respond to the increasing number of patients.
So we hire about 130 doctors and over 150 nurses that work with us on a part-time basis. And so we every day look at the numbers, looking at the previous day, looking at the previous number to see how many we can schedule. So when the volume increases, we increase the number of people that we need to do the consultations. So basically it's we are able to then say, to use the resources very well, to then say, if we are thinking we are getting X number of consultations, then we need X number of clinicians to be able to look after them, to make sure that a person is responded to within 30 minutes. So it's a calculation that we say, if you're going to respond to somebody in 30 minutes, how many clinicians do we need to be able to get to that result? And there's a whole team of people whose job is to monitor that.
And I mean, the potential is incredible here. Does the technology exist? So, for example, if I visited the doctor, they might say, well, I need to listen to your chest, or let me test your blood pressure or your heartbeat. I'm sure, I don't know whether, Claire, you know the answer, or Shivon, is whether there's going to be a widget that you can stick on the end of your finger, plug into your phone and get that kind of information. So for us, sorry.
No, go ahead.
Maybe let me, and then you come in after. So for us in Rwanda, we are connected with the healthcare system. So where if we do a consultation with you and we think that you need to go and do a laboratory test and indeed, go test your pressure and things like that, we do have a relationship with a health facility where you can go and then do the relevant tests. And then these tests come back into a system, and then we can call the patient and complete the consultation. So that's sort of, it's an ecosystem, and we do have relationship with the physical facilities, laboratories, and so on to be able to do that. Over to you, Claire, if you want to add something.
And just to say that I think there's a lot of really exciting opportunities coming in the future with more self-testing and point-of-care diagnostics that hopefully, our system and others will be able to integrate with over time to really provide an even more holistic service to patients in their community.
Brilliant. Well, and perfect timing there, the pair of you. I know that you have to go off and do some work of your own. Thank you for joining us. It's fascinating stuff. And I'd be, if we were having this conversation in 10 years' time, it'd be incredible to see where we're going to be, because the pace is accelerating, well, at a pace, so to say. But for now, thank you both for joining us. And that is Dr. Shivon Byamukama and Claire Morris. Thank you both.
Thank you
very much.
If you want to watch that presentation again, you can go to the Future Health YouTube channel, watch it again there. If you want to carry on the conversation, of course, you can use the chat facility on this brilliant platform that we're using, where you can also network. And for those of you that enjoy social media, use the hashtag. Go to Africa Health Week and also Future Health.